Goitrous hypothyroidism is a type of hypothyroidism that is accompanied by the goiter. Now, goiter is basically the swelling of the thyroid gland that can be due to various reasons, can be due to hypothyroidism, and that can be due to hyperthyroidism as well. Here we will study about the type of the hypothyroid goiter that is due to the hypothyroidism. Now, in case of the hypothyroidism, there are various reasons that can lead to the production of or the development of the goiter. There can be the iodine deficiency that can lead to or that can cause the goiter, or there can be the anti-thyroid agents like the drugs that cause a decrease in the level of the hormone. Then there can be the long-term iodide intake that can also stimulate the production of the goiter. And then there is various hereditary defects that can also lead to the goitrous hypothyroidism. Let's discuss each cause one by one. First of all, the endemic goiter. Now, what is the endemic goiter? You can see this is a type of the goiter that is called as the endemic goiter. Now, what is basically the endemic goiter? In this type of disease, there is the iodine deficiency. Iodine deficiency is the main cause or main culprit behind the disease. In some area where the diet of the people does not have enough iodine, or there's in some area there is the salt water that is used frequently, so it has iodine, and there are some area that are deficient in such facilities. So in those areas, this goiter is very common, and it is because of the deficiency of iodine that lead to the hypothyroidism and production of the goiter. Now, this endemic goiter, most of the cases it is related to the hyperthyroidism, but it can also be related to the hypothyroidism. Now, when the patient is suffering from the endemic goiter, then you know that the patient is suffering from iodine deficiency. So the treatment can be the replacement or the iodine therapy that can then treat the disease, and the goiter or in hypothyroidism can be treated well by using the iodine in the food or as a pharmacological agent. Moving on, there is the goiter induced by the antithyroid agents. Now, antithyroid agents are used to treat the hyperthyroidism. Now, some of these agents are responsible for causing the hypothyroidism, and also they lead to cause the goiter. Now, as I told you that there are mostly the drugs that act on the central nervous system, that are used to treat the mania, and that are used to treat the depression and such kind of the psychotic disease. They cause a decrease in the level of the thyroid hormone. And also some agents that are present in our food, some agents, some hormones, some enzymes that are present inside our body, they may also act on the thyroid hormone to cause a decrease in the production of the thyroid hormone. Now, thiamides is one of the drug class that can lead to the decrease in production of the thyroid hormone, and iodide can also cause a decrease in production of hormone. Beta blockers that are used to treat the various kind of the disorders like the heart disease, the kidney disease, and such other disorders, the beta blockers are used like to treat the hypertension. They can also cause a decrease in the level of the thyroid hormone. So you can say that the patient who is suffering from hypertension, the patient who is suffering from any kind of heart disease, he or she is more susceptible to develop the thyroid hypothyroidism or the goitrous hypothyroidism. Then iodine-131 is a disease that is used in the radioactive treatment. That is a drug that is used in the radioactivity and radioactive treatment, and it can also lead to hypothyroidism and cause goitrous hypothyroidism. Then there is the iodine-induced goiter. Now, in this type of the disease, there is excess level of the iodine that cause a decrease in the thyroid hormone level. as it may cause the resistance, iodine resistance, or it can lead to the thyroid hormone resistance that can be a reason for goiter production or the production of the goitrous hypothyroidism. So in this way, this iodine or excess hormone iodine is causing the hypothyroidism in your body. So these are some basic causes that can cause the goiter: the decreased level of the iodine, increased level of the iodine, and some anti-thyroid drugs that are used to treat other diseases, but as a side effect, they are causing a decrease in the level of the thyroid hormone.